Welcome, everyone. I'd like to introduce Bernadette Liston. Bernadette is a conciliator at the Health Services Commission, and she's very kindly come this morning to give us her time. And I've told her that we're all very much on board with health literacy and communicating with patients at this point of the conference. So
which is what we'll be talking about this morning. Well, I won't be, you will be. So just to tell you a little bit, I come from the Office of the Health Services Commissioner, and look, I just want to say from the beginning, sometimes I feel quite embarrassed doing these sorts of presentations because this is your bread and butter. This is what you have to do every day, isn't it? You've got to talk to patients, you've got to tell them what's going on, you've got to deal with them when they're unhappy or sad or distressed or in pain. I saw just very briefly, is this true? 470 appointments a week, dental appointments from this place? That's, yeah, it was in your before. I mean, that's a lot of that's a lot of dental appointments. And you know, the more people you see, the more times they come, the more capacity there is for things to go wrong. You know, it is because, you know, they're here more often, so, you know, things can... Anyway, so I'm glad to be here. Just to tell you a little bit about, I don't want to go into it a lot. The Health Services Commissioner is the complaint organisation in Victoria. We do take complaints about dental health services. We do have a nice contact in the operational area who we can refer matters to in the first instance if people haven't been able to negotiate that for themselves. But we provide a service where people can come and say, I'm unhappy with some aspect of my healthcare, this happened or that happened. In the first instance, we'll ask them to go back, or have they tried to sort it out with their healthcare provider, and maybe give them some coaching or ideas about how they might do that. We also administer the Health Records Act in Victoria, but I'm not going to be talking about that today. So formally or informally, we help both parties actually to try and resolve the problem. So that's me, and that's where I come from, and I've been working in complaints for a long time, much too long, in fact. So I thought the first thing that we need to think about is what is a complaint, or what could be a complaint, or what might be the beginnings of a complaint if we don't, if we haven't got our antennas out. You know, you've got to be careful. And sometimes you've got to preempt people. You know, if you've got somebody that's stomping in and they're ready, you know, that's how they're coming in, you know that you're going to have to do some work before you go anywhere. So, yeah. A complaint is simply an expression of dissatisfaction or a grievance regarding a specific issue. A complaint, rather than people just venting, usually a complaint also means that people want some sort of an outcome from it. They want something, they want something to change, or they want something to be different next time they come. So what I'd like you to think about, and maybe you're just going to have to bunch around in groups, is think about a complaint. It doesn't have to be a health complaint, and it's probably better if it's not, that you've made recently. And, you know, you can start ticking off all those things. Telecommunications comes in big. What happened? What happened with the complaint? Or what happened, or why didn't you? If you wanted to make, why didn't you? But so what happened? What was the positive thing about the interaction, the contact with the person, whoever they were, that you had? What wasn't good about it? How were you left? And the big thing is, what did you learn? What was some big learning or something that came to you afterwards? So let's start now. You're going to have to scrunch around a bit to talk. I'd rather it in bigger groups of more than two. So you'll just sort of have to scrunch a bit and talk to each other and try and let, yes, that's a good idea. Try and let everybody have a bit of a go. And I'll give you 15 minutes. Well, obviously it's an experience that everybody's had. So tell me, I want to concentrate on the positive things, of course. But so tell me what was a positive thing about the interaction that you had when you complained. Just call them out. You have to call them out loudly, otherwise we'll have to pass it around the microphone. If you want to speak a bit more, if you want to make a longer comment, you'll have to use the microphone, which is...
Down the back.
Down the back.
Sorry.
Okay. So, but first up, let's use some one-word stuff. What was positive?
Listen to.
Okay. Yep.
The problem was dealt with quickly.
Yep. Big voices.
Nothing.
Nothing was positive?
No, not for months.
Okay. Okay. So it was a long delay?
Not the night from the beginning.
Yes. It was my problem. I was mistaken about my address and the company. Okay. It was my problem, apparently, that I had was telling lies about where I lived, the fact that no one of that name lived at this address, and
so you were wrong.
I was wrong.
Yeah.
Yes.
Okay. All right. Thank you. Anything else? Nobody else had any other positive experiences in making a complaint?
I think like when you said, you know, keep your antenna, you know, alert if you can see any negatives, you know, like anybody who's coming with an attitude or something. Be very, very aware of that and just take your time to actually calm them down.
But what about you when you made a complaint?
When I made a complaint?
Yeah. Yeah, this is about what happened to you when you made the complaint.
Again, I need somebody to deal with it as quickly as possible.
And did that?
Yeah.
Okay. Okay. So that was important, getting it dealt with in a timely way.
Replacement.
Compensation.
Yeah, compensation.
You got compensation? You got compensation. Yeah, good outcome. So you got what you wanted. It was sorted. Yeah, it was sorted.
Which company?
Anything else?
Reassurance. They translated my language into their technical language, so they did that really well.
So what would we call that? So that's you weren't, yeah, but you weren't talking the same language because
that's what the problem was.
That was the problem.
And
so they listened very carefully, and they checked the understanding. Yeah, maybe they did. Sorry. So they checked understanding. Maybe they did some clarifying. Yeah. They probably did some questioning. Say that again about being protected.
She felt protected after her complaint.
Processes in place and good support, so you feel quite safe and protected.
Did you feel safe and protected? And this was a complaint about something that had happened?
Yes. Verbal insult.
Okay, okay, so you felt supported. Anything else? Yep.
Perhaps like staff education, so you could place a complaint and they've said, look, we're going to talk to our staff member about that if it's about someone, and that will help them not to do something in the future.
So they took a particular action and they told you about it?
Yes, they followed up on what their plan was.
Yep. Anything else? So if we move away from that, and if you think about your learning, what was your learning from?
Speak up.
Okay. Okay. That's a good one, isn't it? I mean, sometimes you pick your battles, don't you? Mm-hmm. On a daily basis, really, don't you? I mean, you know, these days you do. You just think like, am I going to argue about that, or am I just going to leave it? Or I remember I bought a pair of jeans. I tried on a pair of jeans, and then I said, "Have you got any other colour?" And they gave me the other colour, and so I took the other colour and I went home, and they didn't fit. Like they were a different size. Anyway, so I took them back and I talked to the young woman, and she said, "Oh, I did. Yes. We'll give you a credit." And I said, "Well, no, I don't want a credit." I said, "I want my money back." I said, "It was a mistake. That's fine, but I've had to come all the way back. I just like, you know, you can put it on the credit card." So she said, "No, I'm afraid we don't do that." And I said, "Well, I'm afraid you'll have to call the manager so I can speak to the manager." And she looked at me, and we looked at each other, and she said, "In this instance, I'll do it." And I said, "That's lovely, thank you." So we were all happy. But so that day, I did. I decided to push it. Some other times, if it's a store that you shop in all the time, sometimes I might say, "Okay," you know. But it is that you do pick your fights sometimes, don't you? What else?
Learning-wise, attitude is everything. So aggression won't get you very far when you're complaining, whereas being polite will get you much further, and appreciative of the help that they do give you.
It's not what you say sometimes, it's how you say it. So when somebody arrives, or whatever, I don't know in this context, but ringing somebody up to tell them that their appointment for 2 hours away is cancelled when they're already on their way, and say, "Look, sorry, there's nothing we can do about it if they're away sick." Like, you know. Haven't you ever been to one of those medical centres where they actually talk like that? Yeah? Yes? You know, that sort of business. How different is it to say, "We are so sorry. We are so sorry. It's just happened. They've called in sick. We can't do anything about it. We're trying to get to everybody really quickly. We're so sorry. And we'll try and make your appointment again as soon as possible." What a difference. Yeah, attitude is everything. That's very well put. Anything else?
And your language skills. Well, the way you form your sentences, well, it's similar.
Yeah.
But you've got to have it use your language in a way that you know that they're actually comprehending what you're saying. Because sometimes if you got to pitch your conversation at a certain level, so that the person you're in conversation with understands what you're trying to get across.
Meet the person.
Yes.
I've just been at a conference for 2 days on Thursday and Friday, and we had about complaints, and it always boils down to, you talk a lot about communicating, and we had a cultural anthropologist there. It was fascinating. She talked for about 40 minutes, and it was really, really fabulous. But there are so many ways to miss people, aren't there? You know, and language is just one of them. You know, I shamefully only have one language. I have English. You know, but there's a whole lot of other languages that are going on at the same time. So that's all that stuff about checking, understanding, clarifying and questioning, and trying to meet the other person where they are, I suppose, isn't it?
Yeah, and the difficulties come, of course, when you've got people that English is their second language, and of course they're always just going, yes.
Yes.
And that gets...
So that's why that stuff is so important, isn't it? I'll just put in there, I'll just put language. Yeah. Anything else?
A lot of people actually want to make sure that this won't happen to someone else.
Yep.
Quite often when they ring me to complain, and I ask them, what do you want me to do?
But what do you want when you complain?
It's the same. Yeah. That, like, you know, I don't want that to happen to someone else.
Yeah. So they want the action and don't happen again.
Yeah.
You can see where I'm heading, can't you? I mean, it's not them and it's not us. It's all of us. We all actually want the same thing. We just have to, and it's so It's so easy when it's your place, and this is your place, and can I say what a beautiful place. Makes me really happy when I see public health services being bright and beautiful and welcoming and nice, you know? Haven't got paint peeling off the walls and, oh, you know, anyway, it's lovely, it's lovely. But it's the same sort of, we all want the same, you know? We all want to be treated. You've missed a couple. You've talked about being listened to and you've been dealt with quickly and it's been sorted and they've done all the questioning. What's another thing that they did that was pleasing for you?
Apologise.
Yeah, that's a big one. Yep. Yep. I'll throw it in then. They were probably respectful. Yeah. It's an interesting word, respect, I know. But it's a really important word, and the numbers of people that I deal with in regards to complaints, and the first thing they say is that they were disrespectful. They didn't respect me. They didn't do this and they didn't do that, you know, and it's really easy to disrespect somebody, isn't it? All you have to do is ignore them and make them sit somewhere for an hour and a half without telling them what's going on, or, you know, forget their name, or don't close the door when you go into the consulting room, be interrupted in the consulting room when somebody's there, talking over somebody when they're in the room and talking sort of about them or about other things when they're there. I mean, it's really very easy to disrespect somebody. And as I said, all you have, I mean, really to see it spectacularly, I think, much more so than hospitals and things like that, are private medical centres. It never ceases to amaze me. It really, that sometimes the whole thing going in, sit there, do that. I don't know, you know, the bulk billing services, they're horrible, some of them. Is there anything else in there? Okay, well, let's leave that there for the minute. And now what I want you to think about is, imagine that you're coming to this service to have your teeth done. And I've only been in Melbourne for a couple of years. Previously I worked in New South Wales for a long time. And one of the big hospitals on my patch was a big public dental hospital. And sometimes I seem to spend a lot of time there because they did a lot of work. And I don't know whether it's the same in Victoria, but people used to wait, well, years actually, to get appointments. In the, is it the same here? Yeah. They used to wait years, and then they'd get a really sore tooth, and then they go to the dentist and it'd be taken out. And, you know, bit by attrition over a number of years, if you've got older, you know, 40 or 50-year-olds, all their poor teeth are coming out. And, you know, sometimes they just reached a place where they were saying, this is not fair, you know. And I think it must have been very hard for clinicians, of course, to do that too, because that's not what it's about. Anyway, so you think about you're the one. Just be mindful for a minute. You can close your eyes if you want, and imagine you're the one that's coming to this service. You can give yourself a condition if you want, and just think about what might make you emotional, distressed, angry. What might make you a bit difficult in coming to this?
As a patient. As a patient.
And what do you think you might need? What would make a difference for you in coming into the service if you were in the position that you were in?
Not to be cornered, it's all my fault. To have a bit of reassurance.
Yes, where did that
Here, miss. I said not to be caught that it's all my fault, to have understanding and on my side and reassurance.
Yep. How do you welcome people here?
In the welcome area.
Nice. And how does it work? So if I'm coming in, how does it work? There's a desk there, is there? Or oh no, there's that area.
That's exactly right.
Yeah.
There should be a desk.
Some of the best examples I've seen, Frankston Hospital
Yep.
is a really good example. They've got a welcome service. So when you walk in, you're not just like, sit over there. Somebody asks you, welcome, can I get you a glass of water, a cup of tea? That type of thing. So you immediately, the whole dynamics has changed. Sorry? Yeah, it's a very different environment to what it used to be. By the way, pay complaints have plummeted by 90%. So, exactly right.
Thank you, thank you. Actually, I'll tell you another little story about complaints going down. This was a few years ago, and I was at a seminar or something in a big public hospital in Sydney, and there was a group of people had come out from the States, and they'd been doing this study, and they wanted to trial it in 5 emergency departments throughout New South Wales. And what they were measuring was the patient anxiety in the emergency department. So what they had to do, and this is the study, the nurse had to come up to the patient and say, "Hi, my name's Bernadette. I'll be your nurse for the moment. This is in the emergency department. I'm going to take, do your blood pressure and stuff like that now. It's pretty busy out there at the moment, whatever. It's pretty busy out there at the moment, but we hope to be with you in this amount of time, blah, 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 blah. Now, have you got any questions for me?" So that's taken about 20 seconds. The call rate on the bells in the emergency department went.
Yeah.
It's really simple. I call it early intervention. Well, we talk about early intervention for everything. Huh?
Explanation of the situation.
That's right. And you're being respectful. These are people like you and me. I don't want to go and sit somewhere for 2 hours without being told what's going on.
Yeah.
So this welcoming is fabulous. And providing explanations.
And acknowledgement.
Yeah.
And estimation.
What was that one?
Estimation of the expectation, like if it's time consuming or it's time for considering complaint or whatever.
Talk about time. So we're talking about coming here to this service now. So you in some way that you were distressed or upset or fearful or maybe cranky because last time you came, I don't know, maybe last time you came you had something happen. So you really puffed yourself up coming back.
To be taken into a private room rather than being left fuming amongst a waiting room full of other people.
So that's some sort of acknowledgement of what's happened, isn't it?
Yes, but also taken away from the public view. If you're standing there ranting and raving and really wanting to be listened to, maybe you just, if you're removed into a private room, into another room or somewhere around away from the public.
So come and talk with me. I can see that things are not good. Do you want to talk about it?
We have that. We have an interview room.
Yeah. What else might you need in having a dental
service? You need the infrastructure. You need to have. If you're going to have privacy, you need to have a private room, and you need to have those spaces worked out and a strategy or protocol for handling people when they come in that state. So it's about management and infrastructure as well.
But yeah, it is. But what do you? If you're the patient, what do you want? You do. Maybe somebody saying, "Do you want to talk about it?" You want that acknowledgement, explanations, welcoming. What else do you want?
Action.
Action about?
Well, if you've got a grievance to...
But you haven't got a grievance yet.
Okay.
You're just coming, you haven't got a grievance. You're coming into the service. And you're a bit,
eye contact.
Huh?
Yeah,
Eye contact.
Yep. For some, you have to work that out, don't you? But this welcoming, I love this word. It's a lovely word. You need a welcoming, and that can be many different ways, can't it? Hi, how are you? Terrific. Who are you seeing today? Oh my goodness, they're running 15 minutes late. I don't know, you know, whatever it is. And I suppose that happens everywhere else. I suppose it happens here. They're running 15 minutes late, they're running 30 minutes late. Do you want to take the kids out to run around on the grass and, you know, give us 15 and come back in or whatever? You know, those sorts of things. Do you remember where the toilets are? They're there, and, you know, all that sort of business. What else might you need if you're coming into a service and you're a bit, you know?
Clear direction. I want to know where that department is and where that department is and how I get from there to there.
Yep.
So good signage, good access, good lighting. I know where the toilets are.
What about when you go in to see the clinician?
You want to have a sense of security.
Yep. How do you do that?
You want to feel that clinician giving you time, that they take you seriously, and that they are looking, listening to you.
I've heard that word, attentive. And you know what? In my opinion, it doesn't need to take more time. Because if you don't do it at this end, you do it at this end and it takes 6 times as long because they're all upset and unhappy and distressed. So it's well worth it at this end. It really is. It's like that call bell. That took me, and I was slow. It probably took the nurse 20 seconds to do that. And the patients all said, okay, right, we know what's going on. We know there's a big thing out there, and you've got to come back occasionally and see them and let them know what's going on as well. But it had an amazing difference. So at that end, it's marvellous.
Often they want relief of pain.
Yeah.
They will often want relief of pain 2 hours ago type thing. Yeah.
I mean, it's a big one in a dental service, isn't it? Yeah.
That can increase their anxiety and angst in the welcome area, and therefore snowball.
Yeah. So they want it in a pretty timely way, as most of us do. Or if not, those explanations around it. I mean, dental stuff is interesting. They say that there'll now be a whole mob of kids or cohort of kids growing up who won't be fearful of dentistry. You know, I'm still fairly nervous. I'm not fearful, but I'm still fairly nervous. I don't know why, because it's pretty good these days with the anaesthetics and stuff like that. But I think it's quite a personal thing, isn't it? Having dentistry and your mouth open and having people there, and it is. It is. It is, and it's a big thing. And I think sometimes when it's your bread and butter, it's like anything. It's really easy to forget how. So.
Ask if I find dental chairs really uncomfortable. So if someone has, you know from the medical history, if they have back problems, neck problems, just offer a cushion. You can easily a pillow or some sort of rolled up towel to support their head and neck, and don't assume you can lie them down flat, because that's a really big issue with older people, particularly, or people with skeletal problems. Yeah.
And again, that all goes back to this. We haven't got it up there, and we should put it up there. Because it encompasses a lot of things, doesn't it? Respect. You know, if you respect somebody, you ask them stuff, you check with them, you don't. I mean, have any of you been to an emergency department lately?
Mm-hmm.
Yes. Mm-hmm. Yeah. And sometimes when you're in there, I don't spend regular time in emergency departments, but I did have a poor old dad and we spent a lot of time in emergency departments, and I was just gobsmacked by the number of people who come up and start doing things, even to take blood and stuff like that. They don't introduce themselves. Yes. Introductions, they don't introduce themselves. They don't say what they're going to do. They don't check comfort. They don't ensure privacy.
Come and go and don't let you know what's happening.
Yep.
And leave you there for minutes, hours.
Yeah. So if that makes me feel uncomfortable and unhappy and distressed or anxious or angry, it's likely that it will make somebody else feel the same. I don't think I'm that much different from anybody else, you know? So if it's going to cause that for me, it's going to cause it for somebody else, really.
I was going to say, I think it comes down to open disclosure. So the patient can... I was just going to say it comes down to open disclosure, so the patient can make an informed decision and not feel pressured to have treatment if they do or don't want it. And they're going to feel safe and comfortable in the environment, make a healthy decision on their health.
So that's sort of about consent to treatment, isn't it? I mean, being able to make a real choice about treatment. Informed? Yep. Pretty straightforward, really, isn't it?
Something really important is actually when the patient is lying in my chair, it's a bit hate if I or a dentist keep talking to the nurse about their weekend or the boyfriend or whatever, and not including the patient. That's really, I find that very, disrespectful. So if they're talking with the patient or including the patient in a conversation, even if they can't answer them, that's fine, but talking about private matters and ignoring the patients or the parent or the next of kin sitting in the room, that's extremely rude.
I mean, you see it everywhere. You see that everywhere. You see it in dental chairs. You see it in hospitals. In all sorts of healthcare services where I particularly find that really distressing. You know, when you're treating a patient, how do they feel when you're talking about this, that, or the other? Or you're washing somebody, or you're doing a dressing or something, and you're talking, yeah. And again, that goes back to that respect stuff, doesn't it? Yeah.
Also language, like we tend to use jargon and all that sort of thing. I still remember my daughter being very distressed as a little girl when she overheard they were charting her teeth and they talked about something erupting and she didn't know what erupting meant. She thought something was about to explode in her head.
But it is, and I suppose it must be with a diversity of people. You have a diversity of language, but you also have a diversity of that cultural anthropologist I was talking about. You have a diversity of how people understand things, where, all their backstory, like they come in, but there's all that back there, and I don't know, that story. So you have to go a bit gently sometimes, don't you? Kindly.
Another thing, I would like to have an interpreter if I don't speak English. Not over the phone.
Not over the phone?
Not over the phone, but interpreter present.
And I suppose that's going to be, lots of these things, as we were talking about before, are going to be, have financial considerations, aren't they? It's like I was talking about the peeling hospitals. We had about 3 big hospitals in Sydney for years that they were doing the new buildings, and doing all that for years and years. But in the meantime, the disasters of places that people had to go into and be treated in, was really and it's a hard, sometimes that's a hard mix. And I understand about financial stuff, but some of these don't cost anything either. You know, some of them don't cost anything. Is there anything that we've left out that's really important?
We work in special needs department, and sometimes, you know, we work in special needs. Sometimes if, for example, an autistic person comes with their parents and they're making a fair bit of noise in the waiting room, and everybody in the waiting room is looking at them, more often than not, you know, we offer them, you know, like a private, would you like to come and wait in a private room? That relieves the stress on the parents. Otherwise, you know, would you like, we've got a cafe downstairs, would you like to go and have a cup of coffee? Because we've got about 15 minutes to go, so give them that option and take away the pressure, because the parents are already coming stressed.
So that's that preempting stuff that we talked about.
A lot of times when I sort of listen to this sort of patient complaint management thing, the first thing they say is saying sorry does not necessarily admit fault. And I noticed that where we tend to lack a bit of accountability in our role sometimes, in terms of even basic communication and courtesy. And I feel like you know, even just saying sorry if we kept someone waiting, or you know, there's been a miscommunication, it goes a long way. That's all I have to say.
Yeah. It does go a long way. People are very, very generous. I'm very generous. You know, I'm an optimistic person, and I'm very generous. If somebody says, just all you have to do is tell me, and sorry, I'm really sorry, we're running 15 minutes late. Or, and then when they get in and the dentist says, oh, I'm so sorry for the wait, like, it doesn't take anything, and it makes such a difference to people, because somebody has acknowledged that they're a person and they've been waiting and they're important. They're as important as anybody else. Yeah, I agree. And one of the sessions I was at, my conference yesterday was on open disclosure, and I don't know whether you know about open disclosure, but essentially what it is, it's about a process of letting people know when things have gone wrong, and you know, all that sort of business. And you're allowed to say sorry. You don't have to say, oh, I'm really sorry and it was all their fault and this and this. But you can be genuinely sorry that somebody's had a bad experience, you know? So, yeah.
I was going to say, when you're starting an appointment and you are running late, instead of saying sorry, I actually say thank you for waiting, because you're starting the appointment on a positive note, not on something that could be negative. It's a really useful tool.
And that's that acknowledgement, isn't it? So look, we could talk, and I mean, this is interesting. I just find this fascinating, interesting. There's lots of more stuff we could do. We haven't got time. But I'll just move along a little. Put my glasses on, Bernadette. I used to be able to see a couple of years ago. I've got good distance. It doesn't help much with the stop though. So we've been talking about this. What do you need? So these are these sorts of things that people are coming with. And you don't know what's happened at home, you know, or whether somebody's in hospital, or their mum's really crook, or, you know, the 3-year-old has just had the biggest tantrum you've ever seen, you know, before they left the house, and they're, you know, wound up.
I guess it's that tip of the iceberg sort of analogy, where, you know, what you see is only it's the tip of the iceberg, where you only see a certain percentage of what is actually what they're choosing to disclose to you, whereas below is pretty much the mass of everything that they're going through.
And not all of us are able to articulate nicely what's going on. You know, like that's a big skill, to be able to say, don't talk to me like that, please, because you're really upsetting me. and I find it offensive and I don't want you to say it again. That is really difficult. For some people, what they say is, fuck off and leave me alone. And they're saying the same thing. They just haven't got the, do you know what I mean? They're saying the same thing. And yet, we might call security on them,
Yes.
but we won't call security on me because I've got the language. So it's just, you know, you take that little step back, I suppose. I mean, you know, I just think this is a good conversation to have on a regular basis. You could do it with each other on a regular basis. And it's important because I do it every day and you do it every day. We're dealing with people who are, they're not okay. They're coming to a dental service, they're not okay. They're calling me, they've got a complaint, they're not okay. So we've got to take those steps back. Don't take it personally and try and, you know, step up to it and give them a hand. So yes, who knows what could have been going on for them. And, you know, it's stuff that we all know. I think just, it's like your own place. It's like, I don't know, but, you know, if you all work in the health system, have you ever been to a court? Have you ever had to go to court for anything? If you have, I mean, it's another system and it's scary and, you know, and you walk in and you think, well, where do I go and who do I talk to and will somebody call me and how do I do this and what forms do I fill in, all of that sort of business. Well, it's all these different systems. This is your place. You know it. You're comfortable with it. You know the systems. You know the people. You know how it all works. They don't. Even if they come here often, they don't. I think that's all, unless... but I would say that really, I think these conversations about how you do this, because it is hard sometimes. When you've had a long day or a bad day and people have been cranky with you or whatever, to take that step back and just gather yourself, use your mindfulness, really and truly, gather yourself. Don't take it personally. You know, sit and start from the beginning. Start from the beginning.
Can I make something, a positive comment? Because what tends to happen, we tend to hear from the people who aren't happy about something. They're much more likely to complain than to, apart from oh, thank you, and this is great when you walk out the door. At my agency, they've recently put up a tablet-based instant sort of feedback thing at both the main reception and then again at the dental entrance. And it's amazing the number of, a lot of people just walk out, that's fine, but we have had so much more positive feedback that people have, you know, it's just a tick box sort of thing where, and they can leave a, you know, a written, like, or a typed comment if they want to. But it's been really, really great because we're starting to think, you tend to focus on the complaints and seeing all these, that the complaints are outnumbered hugely by the people who bother putting in positive feedback, and it's been really good.
That's a fabulous thing. And it would be a fabulous thing for them because, again, it's saying, we value your experience, let us know how it went, tell us about stuff, you know? Yes. And people are incredibly generous, aren't they? Really? Yeah. So thank you. And thank you for giving up your Saturday morning.